The United States is the only civilized, industrialized country in the world without some form of universal health care for its citizens. The time is right to correct that social catastrophe. The question is not what to do, but how to do it. The choices that are discussed come down to a single-payer system, something akin to Medicare, or expanding a system based on many private health insurers as we have now. Both systems have their advantages and disadvantages. Our present system, based on many private health insurers and small pools of people at individual employers, has many inefficiencies built into it. Each health insurance company duplicates management and infrastructure, and the small pools of insureds cause increased premiums if any person in a pool has an illness. Single-payer systems require increased government involvement and perhaps even complete government control, depending on the type of single-payer system. A typical single-payer system many people advocate would be totally controlled by the government and paid for by payroll taxes like a much larger Medicare system. A single-payer system could have increased efficiencies since management duplication would be eliminated, but some of that efficiency would be erased by the tendency of government bureaucracy to grow and become inefficient with size. I believe that we can use portions of both systems and construct a healthcare system that surpasses anything available today. A system of health insurance purchased through a partnership of mandatory pool contributions from employers, workers, and the government, and the forced cooperation of private insurance companies may be the most politically possible and functional plan, since it would basically use the structure of the present system but improve its weaknesses and expand its coverage. I call this alternative Insure Plus. Insure Plus would provide a basic health care plan to everyone, including preventative care, and require the reduction of premiums from insurance companies for the basic plan. All premiums would be approved or set by the government, similar to utility rates. Under Insure Plus, insurers could reduce the premiums for basic coverage since the pool of those insured would expand. Premiums are calculated by insurance companies from the risk involved in a small pool of people, often simply those who work at a specific company. In a smaller pool, one ill person can drastically raise the insurance cost of the entire pool. Under Insure Plus, insurers would be required to maintain much larger pools of those insured, perhaps as large as everyone with coverage by the insurer in a state or even region of the country. Under Insure Plus, one claim form would be mandatory for all insurance companies, and all billing codes would be uniform and mandatory. Insurance companies would be forced to pay a penalty on claims that are not paid electronically within 15 days from when they are electronically submitted by a healthcare provider. Claims denied as not medically necessary would be reviewed by an arbitrator working for the government, and if a denial is reversed, the insurer would pay a penalty to the patient from the date the procedure was requested as compensation. The reasonable and customary charge in the community for any procedure would be set by the government and not arbitrarily by each insurance company as is done now.